The lymphatic system is the system that helps return the lymph back to the blood, and the lymphoid organs and tissues are the structures of the immune system. These are two separate systems, but they overlap in structures and function. The lymphatic system has the lymphatic vessels and the lymph nodes. The immune system has the lymphoid cells, the lymphoid tissues, and the lymphoid organs. The lymphatic vessels are the vessels that are going to return the fluid that was left in the interstitial space back to the blood. When we filtered fluid from the blood, not all of it returned to the blood, and that interstitial fluid, that fluid that was left in the tissues, was there to bathe the tissues. But we need to return that fluid back to the blood. When we return it back to the blood using the lymphatic vessels, that fluid becomes known as lymph. About 3 liters daily needs to be returned from the tissues to the blood. This is necessary to maintain our blood volume. The lymphatic vessels are a one-way system designed simply to return the lymph back to the blood. So as we see, the green is the lymphatic system, one-way vessels all moving back toward the heart. The lymphatics begin as blind-ended vessels between the cells and the blood vessels of the capillaries, and these are widespread except in the bone, the teeth, the bone marrow, and the central nervous system. Here you see the blood capillaries, and in green you see the lymphatic vessels starting out as blind-ended capillaries that are going to feed into larger and larger tissues. The lymphatic capillaries are similar to the blood capillaries. They are more permeable. The endothelial cells are not held together by tight junctions, but rather the cells overlap in such a way that we have many valves. Collagen fibers help anchor the endothelial cells so that whenever there's increased pressure in the tissue, the fluid will flow into the lymphatic vessels. Protein doesn't get out of blood, but it does easily get into the lymphatic system. And here you see these overlapping cells. These are the collagen fibers that anchor the cells. And whenever there is increased pressure, this end of the cell is pushed down, leaving a large opening so that fluid and any debris from the cell or any large molecules like protein can get into the lymphatic capillary. There are specialized lymphatic capillaries in the small intestine. These are known as lacteals. They transport absorbed fat from the small intestine to the bloodstream. The lymph in this area is milky white due to the little fat particles that are suspended in it, and it's referred to as chyle. The lymphatics merge into larger and larger collecting vessels, which merge into trunks and which eventually merge into the two major ducts. Their purpose is to return the lymph to the blood. Lymphatic collecting vessels are similar to veins. They have the same layers or the same tunics, but they have thinner walls and more internal valves. Also, there are many more anastomoses between the lymphatic vessels. In skin, the lymphatic vessels travel with the superficial veins, but the deep lymphatic vessels travel with the deep arteries. The lymphatics drain from the periphery toward the blood. The right side is only drained by one set of vessels, so only the right upper quadrant is drained by the right lymphatic duct, but the left side, the left lymphatic duct, drains all of the lower part of the body as well as the left side of the body. The thoracic duct, or the left lymphatic duct, and the right lymphatic duct both empty into the subclavian veins, the right and left subclavian veins, and that is where the lymph is returned to the blood. Lymphangitis is inflamed lymphatics. There are blood vessels that nourish the lymphatic vessels themselves. These become engorged with blood whenever the lymphatics are inflamed. The lymphatic pathway then becomes visible through the skin, and these are the red streaks that you may notice whenever there is an infection. There is no pump in the lymphatic system. The lymphatics normally have a relatively low pressure in them, and so they use some of the same return mechanisms as veins. They rely on the skeletal muscle pump and the respiratory pump, and they have valves to prevent backflow. Usually, lymphatics are bundled with arteries, particularly the deep lymphatics, so the pulsing of the arteries also helps to assist the return of lymph to the blood. Movement in the lymphatic vessels is sporadic and slow. The tissues must be active, they must be moving, otherwise lymph will stay trapped in the tissue. Whenever there's something that prevents normal lymph return, lymph builds up in the tissues. This can happen if the lymphatics are blocked or if they have been surgically removed. This can happen during cancer surgery. Lymphedema may improve if some of the lymphatic pathways remain and can enlarge to help drain the lymph better. The lymphoid cells are the immune cells and support cells of the immune system. The lymphocytes are one set of these cells. The lymphocytes protect from foreign proteins, which are called antigens, and there are two types of lymphocytes. The T cells do what is called cell-mediated immunity. They attack foreign cells directly. The B cells produce antibodies. They do this by making plasma cells. Antibodies are proteins that will circulate in the blood and inactivate the antigens. The second immune system cell are the macrophages. Macrophages are phagocytes, so they take care of any foreign substances. They also help activate the T cells. Dendritic cells are the third cell of the immune system. These cells migrate around under the skin and mucous membranes. Anything that comes through these areas tends to be captured by the dendritic cells, which take them to the lymph nodes so that they can be introduced to the T cells and the B cells. The reticular cells are the cells that produce the fiber network that support the other cells. The lymphoid tissue houses and provides proliferation sites for the lymphocytes. It also furnishes a surveillance vantage point for things that are in the body. Lymphoid tissue is largely composed of loose connective tissue, actually reticular connective tissue. These are large open networks of fibers with lots of space. Macrophages live on the fibers, and the lymphocytes can squeeze through the blood vessels, hang out in this space for a little while, and then return to the blood to patrol the body. Diffuse lymphoid tissue is found in pretty much every organ in the body. Lymphoid follicles are tightly packed follicles with lymphoid cells and reticular fibers. Lymphoid follicles are what make up the lymph nodes. The lymphoid organs can be divided into the primary lymphoid organs and the secondary lymphoid organs. The primary lymphoid organs are the sites where the B and T cells mature. Red bone marrow is where the B cells mature, and the thymus is where the T cells mature. Now, the thymus is a gland that's in the mediastinum. It's fairly large in the child, but it diminishes in size in the adult. The secondary lymphoid tissue is where the mature lymphocytes will first encounter their antigens. Lymphocytes become activated in these areas. This will be the lymph nodes, the spleen, and the mucosa-associated lymphoid tissue or MALT tissue. This would be the tonsils, Peyer's patches, and appendix. The lymph nodes cluster along the lymphatics, and their job is to filter the lymph and cleanse the lymph. The lymph, remember, was that interstitial fluid that washed through the tissues, so it's going to have all kinds of little cellular debris and junk and protein and all kinds of stuff in it. And the lymph nodes filter that out so that it doesn't return to the blood. The lymph nodes also act as a site of immune system activation. Since they're pulling all of these foreign proteins and things out of the blood, and since we have lymphocytes that hang out in the lymph nodes and macrophages that hang out in the lymph nodes, they get a chance to come in contact with their antigens. There are large clusters of lymph nodes in the inguinal area, the axillary area, and the cervical regions. If there is excessive activity in a lymph node, they may enlarge, and these can sometimes be palpated and are indicators of active infections. The spleen provides a site for lymphocyte proliferation, surveillance, and response. It cleanses the blood. This is the blood filter. Not only does it look for foreign proteins, but it helps recycle and break down the red blood cells. It stores blood platelets and monocytes for release when they're needed. There is some evidence that it's a site of red blood cell production in the fetus, and it acts as a blood reservoir. Anything that's foreign in the blood will go through the spleen, and the spleen will take it out. Since the spleen filters blood, any foreign proteins in the blood will be collected in the spleen. The lymphocytes of the spleen will then have an opportunity to respond to it. A splenectomy is a surgical removal of the spleen. Now, the spleen is a pretty fragile organ and it's easily ruptured. At one time, it was very common to remove the spleen to control bleeding, but we've now discovered that if the spleen is left alone, it can often repair itself. Should the spleen be removed, the red bone marrow and the liver can take over the functions of the spleen. The mucosa-associated lymphoid tissues, or MALT, are lymphoid tissues that are located in mucous membranes throughout the body. One collection of these cells are the tonsils. The tonsils guard the entrance to the pharynx. The way the tonsils are constructed is they have crypts or spaces in them, and bacteria will go into these crypts, the idea being that the immune system can deal with it there. However, sometimes there is more bacteria than the tonsils can take care of, and the tonsillar crypts may actually become a source of infection. Peyer's patches are clusters of lymphoid follicles in the wall of the distal portion of the small intestine, and the appendix is an offshoot at the beginning of the large intestine. Both of these prevent bacteria, which is prevalent in the intestine, from breaching the intestinal wall and getting into the bloodstream.